Caries susceptibility testing is a valuable tool in assessing your patient's caries risk level and oral physiological deficiencies. Before any visit where a salivary diagnostic procedure is planned, instruct the patient not to smoke, eat, drink, brush their teeth, or use a mouthwash 1 hour prior to their appointment. Resting saliva testing. Cut one piece of litmus paper into 5 equal segments. 4 of these pieces will be used to test the patient's resting saliva pH, and 1 will be retained for later stimulated saliva pH testing. Using cotton pliers, hold one segment of litmus paper against the patient's left parotid papilla until a small amount of saliva is absorbed. Next, test the patient's right parotid saliva flow in a similar manner. Test the patient's sublingual and submandibular saliva by placing the litmus paper on the lingual caruncles. Retract the patient's upper lip and place the litmus paper in the depth of the maxillary vestibule. Relax the lip to ensure adequate saliva absorption before removing. Compare the color of each piece of litmus paper with the provided pH guide to determine the resting pH at each location. A pH of 7 or less indicates an acidic secretion. Stimulated saliva testing. In order to test the patient's stimulated saliva, you will need a graduated medicine cup and a small piece of unflavored wax. Instruct the patient to chew on a piece of wax to stimulate their saliva flow over the course of 5 minutes. Give the graduated cup to the patient and instruct the patient to spit into the cup as often as they feel necessary. They should not swallow any saliva. After collecting the saliva for 5 minutes, note the volume of saliva to determine the patient's stimulated salivary flow rate. Visually assess the amount of saliva produced and examine the consistency. Using the retained piece of litmus paper, test the pH of the stimulated saliva by quickly dipping part of the paper into the cup and comparing the color to the pH guide. Again, a pH less than 7 indicates acidic saliva. To test the patient's stimulated salivary buffering capacity, open the test strip and place it on top of the foil package. Place 1 drop of saliva on each of the colored squares. Wait 2 minutes and assess the color of each square. Add the points of the squares together with green squares equal to 4 points, blue equal to 2 points, red equal to 0 points. A color between 2 of the color values results in an average value. For example, blue-green equals 3 points. A total score of 5 or less indicates very low buffering capacity. A score of 6 to 9 indicates low buffering capacity, and a score of 10 to 12 indicates normal to high buffering capacity. Microbiological testing. To test the type and quantity of Streptococcus mutans present in the patient's mouth, empty the contents of the foil package onto a clean surface. Obtain 0.3 milliliters of a patient's saliva. The third line on the pipette indicates 0.3 milliliters. Pipette the patient's saliva into the mixing container. Add 1 drop of the reagent number 1 to the mixing container and thoroughly mix. Next, add 4 drops of reagent number 2 to the mixing container and again mix well. The saliva sample should change to a light green color. Pipette enough of the saliva mixture to fill the sample window at the end of the testing device. Allow the test to sit for 15 minutes. A distinct, thick red line will appear in the testing window under the letter C, indicating the test is working correctly. If the sample contained a high level of virulent Streptococcus mutans, a thin red line will appear under the letter T, in the test window. To quantify the patient's Streptococcus mutans and lactobacillus levels, a traditional culture is necessary. Remove the green culture device from the tube. Open and place one bicarbonate tablet into the testing tube. Remove the plastic from each side of the culture device. Pipette enough saliva to thoroughly coat each side of the culture media. Return the testing device to the clear tube and close tightly. Be sure to label the white cap with a HIPAA-compliant patient identifier. Incubate the tube for at least 48 hours at 37 degrees Celsius. Compare the results on each side of the green testing device with the diagram to determine the patient's bacterial levels. To determine the metabolic activity of the patient's biofilm, the ATP level should be assessed. Begin by calibrating the meter. Once turned on, the meter will count down from 60 to 0, at which point it will beep and be ready for use. Firmly wipe the swab against the lingual surfaces of the mandibular anterior from canine to canine and replace the swab into the provided tube. Be careful not to touch the gingiva with the swab, or it will result in a false positive. Break the blue plastic snap valve by pushing the bulb in 2 directions before squeezing. Mix the reagent around the swab tip thoroughly. Place the tube into the meter and press OK to begin analyzing the sample. The meter will count down to 0 before displaying results. During this time, it is important that the meter remains in a vertical position. The meter will display an RLU value corresponding to the level of ATP in your biofilm sample.